Community members queued to undergo screening for various illnesses, including non-communicable diseases such as high blood pressure, cancer, and diabetes. The screenings form part of efforts to promote early detection and treatment of conditions that continue to affect the growing number of people. Non-communicable diseases have become the leading cause of death in South Africa, surpassing communicable diseases since 2016. This trend has raised serious concerns within the health sector, as these conditions often develop silently and place long-term pressure on individuals, families, and the healthcare system. Residents want the government to prioritize rural areas due to limited access to healthcare services.
I think the campaign must not end up here. They must take this campaign to the rural areas where there are a lot of people who do not know exactly what is happening. So if they can take this campaign there, advocate about these diseases, and make sure that it is a mandate for everyone to undergo all the tests to ensure that they've got good health.
There are lots of rural areas around Giyani. I would request that they should take mobile clinics to those rural areas. The elderly people who are sick and do not have money to go to hospitals and clinics are mostly affected and need this kind of help. Authorities say the elderly remain the most affected by non-communicable diseases. People are encouraged to do regular health screenings even when they do not show any symptoms.
If people know what are the risks, and so health promotion and health education is really what this campaign of today largely is about. People to be aware what are the risks in terms of this non-communicable disease, what are the risk factors, and how do you then also make sure that you can be screened. Firstly, you must be able to know and avoid. We know that the most commonest are your blood sugar problems, diabetes, and then high blood pressure, which have got various further complications in terms of diabetes. You can even lose your sight. There are other complications. You can lose your foot. When you get a small wound and it gets complicated, end up with amputation, just as an example.
Authorities say they are working closely with traditional health practitioners to help integrate the indigenous knowledge systems and the traditional medicine into the formal healthcare sector.
We are working with them to try and make sure that there is a proper regulation so that they can also be formalized. But over and above that, even on issues of the non-communicable disease, we actually have a program where we train some of them so that over and above trying to formalize their practice. But in terms of the tools available, they must also have an understanding when somebody comes, if they know how does sugar diabetes present, they must be able to have some idea that this one may have sugar.
Health officials have described the non-communicable diseases as a looming crisis, particularly in rural and underserved areas. Screenings conducted during the campaign included blood pressure checks, glucose testing, and general health assessments aimed at early detection and encouraging healthier lifestyles. I'm Maluleke, SABC News, Giyani.